Peptide Antibiotics. Peptide Antibiotics. Chapter 16. Peptide Antibiotics. Polymyxins. Introduction. Of this group of polypeptide antibiotics, polymyxin B and polymyxin E, colistin and colistin are most commonly used topically and PO. Source: polymyxin B, Bacillus polymyxa; polymyxin E, Bacillus colistinus. Colistimethate is a form of colistin intended for parenteral administration. Mechanism of action. Polymyxin are cationic surface active agent, detergent-like action on cell membrane of bacteria. Binding is competitive with calcium and magnesium. Polymyxin are rapidly bactericidal. They interact strongly with phospholipid in bacterial cell membrane and radically disrupt their permeability and function. As a result, iron amino acid leak out and cell die. Antimicrobial spectrum. They are effective against gram-negative bacteria and ineffective against gram-positive bacteria. The polymyxin are more effective against gram-negative bacteria. They are rather narrow spectrum, include Erythrobacter, Klebsiella, Pseudomonas, aeruginosa, Salmonella, Pasteurella, Bordetella, and Shigella species, and Escherichia coli. Most Proteus species are not susceptible. Resistance. Although intrinsic bacterial resistance to polymyxin is recognized, resistance is uncommon and is chromosome dependent only. Interaction. Polymyxin acts synergistically when combined with potentiated sulfonamide, tetracycline, and some other antibacterials. They reduce the activity of endotoxin in body fluid and may be beneficial in endotoxemia. Their action is inhibited by divalent cation, unsaturated fatty acid, and quaternary ammonium compounds. Pharmacokinetic properties. Polymyxin are not absorbed after PO or topical administration and do not cross BBB. For systemic effect, they are administered parenterally. Colistin sodium methanosulfonate plasma level peak approximately in 2 hours after parenteral administration. Systemically rarely used due to serious toxicity, nephrotoxicity, neurotoxicity, and neuromuscular blockage. Blood vessels usually are low because polymyxin bind to cell membranes as well as tissue debris and purulent exudates. The polymyxin undergo renal elimination mostly as degradation products, and their plasma half-lives are 3 to 6 hours. Adverse effects. They are notable nephrotoxic and neurotoxic. Neuromuscular block can be seen at higher concentration, intense pain at site of injection, and hypersensitivity. Reaction also can be expected. Polymyxin B is a potent histamine releaser. Therapeutic indication. The main indication for parenteral use of polymyxin is life-threatening infection due to gram-negative bacilli or Pseudomonas species that are resistant to other drugs. Polymyxin are also used PO against susceptible intestinal infection. Topical application is common for otitis externa. Other antimicrobial agent. Bacitracin are branched cyclic decapeptide antibiotics, polypeptide product of Bacillus subtilis. Bacitracin A is the most active of the group and the component of the commercial bacitracin preparation that are used either topically or PO. These antibiotics are bactericidal. They interfere with cell membrane function, suppress cell wall formation by preventing the formation of polypeptidoglycan strand, and inhibit protein synthesis. It binds with the pyrophosphate lipid carrier and inhibits the dephosphorylation reaction required for regeneration of the lipid carrier. It also increases the fluxage of iron by binding to the bacterial cell membrane. Bactericidal activity required the presence of divalent cations such as zinc. The spectrum of bacitracin is similar to that of penicillin G and is mostly limited to gram-positive and a few gram-negative bacteria as well as some spirochetes. Most gram-negative organisms are not susceptible, probably due to lack of penetration of the drug through the outer membrane. Resistance is rare. Bacitracin are often used in combination with neomycin and polymyxin to enhance the antibacterial spectrum. Bacitracin are not appreciably absorbed from the GI tract and are not used systemically because of their pronounced nephrotoxicity. However, they are used only locally in topical powder and ointments. Dermatological preparation, eye and ear ointment, especially against Staphylococcus in combination with neomycin or polymyxin as an alternative to vancomycin in antibiotic-induced pseudomembranous enterocolitis in treatment and prevention of enteritis caused by Clostridium perfringens in pig and necrotic enteritis in poultry. Used as feed additive in swine and poultry ration for growth promotion. In antibiotic-associated pseudomembranous colitis caused by Clostridium difficile cytotoxic bacitracin given PO is considered an alternative to vancomycin. Hypersensitivity reaction to bacitracin are seen occasionally. Glycopeptide antibiotics, vancomycin, high molecular weight glycopeptide obtained from Streptomyces orientalis, active against gram-positive organisms, especially cocci, bactericidal MOA cell wall synthesis inhibitor like penicillin bind to D-alanine terminal of muramyl dipeptide and inhibit the release of building block unit from the lipid carrier and thus prevent its addition to the growing end of polypeptide of peptidoglycan. Used as substitute of penicillin in patients allergic to penicillin, parenteral show IV infusion since it's highly retained in serious methicillin-resistant staphylococcal infection. Orally to treat antibiotic-induced pseudomembranous enterocolitis caused by Clostridium difficile cytotoxic and topically in skin infection along with polymyxin. Last resort drug in human to treat multi-resistant gram-positive bacteria combined with aminoglycoside for treatment of enterococcal infections and endocarditis combined with rifampin for staphylococcal infection. Common toxicities: hypersensitivity, ototoxicity and nephrotoxicity. Tyrosine mixture of germicidin and tyrosidine obtained from Bacillus brevis, mainly effective against gram-positive bacteria including streptococci and staphylococci, act on cell membrane, causes leakage and also uncouple oxidative phosphorylation in the bacteria. Not absorbed orally is too toxic for systemic use and cause hemolysis. Used in bovine mastitis during dry period as intramammillary infusion to treat metritis by IV infusion and topically for skin 0.5 mg per gram cream in early infection as 0.5% solution. Does not cause hypersensitivity reaction. Virginiamycin, antibiotic produced by Streptomyces virginia, used in treatment and control of dysentery in piglet as feed additive 100 gram per 900 kg per kg feed for 2 days. Has growth promoting potential in pig like salinomycin. salinomycin, trimulin, derivative of diterpene, antibiotic fluorometylene obtained from Pleurotus mytilase, bacteriostatic drug active against gram-positive bacteria, mycoplasma, and anaerobe including Treponema hypodysentery. Act through inhibition of protein synthesis by binding to the 50S subunit of bacterial ribosome. Well absorbed orally, used for treatment of angiotic pneumonia of swine, 50 mg per kg IM, and oil injection, and pneumonia of calves caused by mycoplasma, 20 mg per kg IM. Thiamulin hydrogen fumarate is given orally in food or drinking water, 8.8 mg per k per day, to control mycoplasma infection in poultry. In poultry, it interferes with monenase and salinomycin metabolism. So if drugs are fed together, they become toxic. Potentiation of inophore myotoxicity. Miscellaneous antibacterials. Cycloserine, short, Streptomyces orchidaceae. Mechanism of action. Cycloserine is an analog of the amino acid D-alanine. It interferes with an early step in bacterial cell wall synthesis in the cytoplasm by competitive inhibition of two enzymes, L-alanine racemose, which form D-alanine from L-alanine, and D-alanine D-alanine synthetase, which incorporate D-alanine into the pentapeptide necessary for peptidoglycan formation and bacterial cell wall synthesis. Oral tuberculostat, slow development of resistance, no cross resistance, well distributed including CSF. Side effect accumulates in serum and causes renal insufficiency, CNS disturbance, epileptic seizure, and peripheral neuropathy. Inophore antibiotics. Inophores. Carboxylic inophore polyether antibiotics are streptomycin products, mainly used for feed efficiency and coccidial activity. Inophore include lactulose, medramycin, monensin, neracin, salinomycin, and samduramycin. Behave as alkali metal ionophore and alter the cell permeability. They form a complex with sodium ion in the cell membrane and causes passive transport of A+ and replacement by hydrogen ion, decrease intracellular pH, sidal to gram-positive organism. Shift the rumen microflora toward gram-negative population. Shift in volatile fatty acid production, increase propionic acid production, better feed efficiency, decrease acetic and butyric acid production leading to decreased carbon dioxide and methane formation. Pharmacokinetics. Rapidly absorbed after oral administration in monogastric animals, 50% absorbed in ruminants, rapidly and extremely metabolized in liver, excreted in bile and eliminated in feces. Horse, unable to eliminate rapidly, more toxic. Toxicity. Relative toxicity, salinomycin greater than lactulose, greater than nasorecin, monensin, medramycin, causes cellular electrolyte imbalance, increase extracellular potassium and intracellular calcium, cell damage and death. The skeletal and cardiac muscle are most sensitive. Skeletal muscle, dog, ostriches, sheep. Cardiac muscle in cattle, horses are the most susceptible species to toxic effect when accidentally exposed to ionophore containing feed. Turkey are more sensitive than chicken. Thiamulin administration concurrently with monensis caused sign of severe inophore toxicity in chickens and pigs. Clinical application. Clinical application. Monensin coccidiosis and toxoplasma infection. Monensin influences the production of volatile fatty acid, which promote growth and feed efficiency and help to prevent bloat and ketosis in cattle. Hence, they are administered as premixing or mediated feed or for growth promote feed efficiency. Lactaloside, lactaloside, control of coccidiosis in cattle, chicken, and sheep. Medramycin, permix for coccidiosis control in chicken. Salinomycin, narasin, and semduramycin, coccidiosis control in chicken. Streptogramins, streptogramins. Streptogramins are a group of natural virginiamycin, pristinamycin, or semisynthetic quinopristin, dalfopristin cyclic peptide. Inhibit protein synthesis by undergoing strong irreversible binding to the 50S ribosomal subunit. Spectrum of activity. Spectrum of activity. Gram-positive aerobes and anaerobes. Gram-negative are resistant except Leptospira haemophilus, growth promoter in animals. Fusidic acid. Fusidic acid, lipophilic steroid antibiotic, prevent protein synthesis by preventing binding of amino acid tRNA to a site. Active against gram-positive bacteria and Mycobacterium tuberculosis. Gram-negative organisms are resistant. Hydroquinolones not absorbed well after oral administration, used for the treatment of gastrointestinal tract infection caused by protozoa and giardia. Isoniazid, most potent anti-tuberculosis drug, bactericidal. Mycobacterium bovis also susceptible. Mechanism of action is unknown. Treatment of Jones disease useful in actinomyces bovis, orally well absorbed. Readily developed resistance. Carbadox, quinoline derivative used to promote growth and prevent diarrhea, inhibit bacterial DNA synthesis and denature pre-existing DNA, more effective under anaerobic conditions, highly effective against Clostridia, used as growth promoter in pigs. Rifampin, bactericidal synthetically modified member of rifampicin, first line oral drug for tuberculosis. Mechanism of action. Inhibit RNA polymerase, prevent transcription, active against gram-positive bacteria, anaerobes, and Mycobacterium tuberculosis. Has antiviral and antifungal activity to some extent. Gram-negative relatively impermeable to the drug. Resistance. Chromosomal mutation occur at a high frequency, hence used in combination with other antibiotics. No cross resistance. Pharmacokinetics. Good oral absorption in monogastric animal, highly lipophilic, better tissue penetration, except blood-brain barrier only during infection. Penetrate phagocytic cell, metabolite excreted through bile, enterohepatic circulation, metabolite color urine, feces and saliva orange red. Hepatic enzyme inducer, drug interaction along with trimethoprim, human UTI, along with penicillin G or erythromycin RQI, along with amphotericin B, fungal infection. Clinical application used in tuberculosis, veterinary usage, macrophage associated bacteria, Brucella, RQI, pseudotuberculosis, Staphylococcus aureus in bovine mastitis, streptomycin, isoniazid, rifampin, Jones disease in goat. Toxicity, immunoallergic reaction, may be teratogenic, self-limiting hepatotoxicity, novobiocin, streptomyces product, semi-synthetic broad-spectrum bacteriostatic drug, occasionally used in local treatment of Staphylococcus aureus, particularly mastitis in cow. Mechanism of action: it inactivates beta subunit of DNA gyrase and inhibits supercoiling. Activity decrease in alkaline pH. Chromosomal resistance readily develops, well absorbed after oral administration, moderate distribution, and excreted through bile and enterohepatic circulation. Toxicity: skin eruption, eosinophilia, thrombocytopenia, leukopenia, mastitis, along with procaine, penicillin, dry cow therapy, along with tetracycline. It is used in non-specific upper respiratory tract infection in dogs. Thank you so much.